Hello and welcome. My name is Dr. Satish Goyal, and I'm a cardiac electrophysiologist. If you are watching this video, it is because we have decided to start you on a medication called dofetilide, which is also known by the brand name Tikosyn. We understand that starting a new heart medication can bring up many questions. The purpose of this video is to help you understand why we are using dofetilide, what to expect as we begin this therapy, and how to take it safely for the best results. Our goal is to be your partner in managing your heart health, and this video is an important first step. You are being prescribed dofetilide to treat a heart rhythm condition called atrial fibrillation, or AFib. In a normal heart, the electrical signals are regular and coordinated, like a steady drum beat. In atrial fibrillation, however, these signals become fast and chaotic, causing the upper chambers of your heart to quiver instead of beating effectively. This can cause symptoms like racing or pounding heart, shortness of breath, fatigue or dizziness. More importantly, it can affect your quality of life. Dofetilide is a type of medication known as an antiarrhythmic. Its job is to help your heart return to normal rhythm, which is a steady rhythm. It works by acting on the electrical properties of your heart cells to relax an overactive heart. For many patients, this can mean fewer symptoms and a significant improvement in how you feel from day to day. Starting dofetilide is a process we manage with the utmost care. For your safety, the first few days of your therapy must take place in the hospital. This is a mandatory safety requirement for every patient starting this medication. Why is it necessary? While dofetilide is very effective, it can have a specific effect on your heart's electrical system. We need to monitor this effect closely to find the dose that is both safe and effective for you. Specifically, we will be watching something on your EKG called QT interval. The QT interval is a measurement of the time it takes for your heart's electrical system to recharge after every heartbeat. Dofetilide is designed to lengthen the QT interval slightly. That's how it works. However, in a small number of patients, the interval can become too long. If the QT interval becomes excessively prolonged, it can increase the risk of a serious but rare irregular heartbeat called torsade de pointes. Our primary goal during your hospital stay is to prevent this from happening. We will place you on a continuous heart monitor called telemetry, and we will perform an EKG 2 hours after each of the first 5 doses. By carefully checking your QT interval after each dose, we can find the perfect dose for you. If we see that our QT interval is becoming too long, we will simply lower the dose or stop the medication. After 3 days and 5 monitored doses, it is considered safe for you to continue the medication at home. Once you're on dofetilide, there are some very important precautions you must take. Certain other medications can interfere with how your body processes dofetilide and can dangerously increase the effect on your QT interval. It is absolutely critical that you do not take any of the following medications: hydrochlorothiazide or HCTZ, a common water pill, the antibiotic combination of trimethoprim and sulfamethoxazole, known as Bactrim or Septra, verapamil, a blood pressure and heart medication, cimetidine, an over-the-counter heartburn medication, and several other less common drugs like ketoconazole, prochlorperazine, and megestrol. Before you leave the hospital, You should expect to get a complete list of these medications. You must make a habit to tell every doctor, dentist, and pharmacist that you're taking dofetilide before starting any new prescription or over-the-counter product. This is the most important step you can take to ensure your long-term safety. Taking dofetilide successfully at home requires a commitment to consistency. You must take your dose as close to every 12 hours as possible. Setting a daily alarm on your phone or a clock is an excellent way to stay on schedule. If you're less than an hour late for the dose, take it right away. However, if you're more than 1 hour late, simply skip that dose and take your next one at its regularly scheduled time. Never ever take an extra dose to make up for a missed one. If you happen to miss more than one dose in a row, do not restart the medication on your own. You must call our office immediately, as you will likely need to be readmitted to the hospital to restart it safely. As an outpatient, you will also need regular checkups. This includes an EKG and blood work at regular 6-month intervals to monitor your QT interval and check your kidney function and electrolyte levels like potassium. The good news is that dofetilide is usually very well tolerated and most people have minimal or no side effects. The most common ones are mild and may include heartache or nausea. However, there are important warning signs you need to watch for. Please call our office immediately if you experience any new dizziness, lightheadedness, or fainting spells, or a new fast or irregular heartbeat that feels different from your usual AFib. Additionally, certain conditions can affect your body's electrolyte levels and increase your risk. Let us know if you have severe or prolonged diarrhea, vomiting, or heavy sweating, as these can disrupt your body's balance and make the medication less safe. Starting dofetilide is a proactive step towards managing your atrial fibrillation and improving your quality of life. While the process requires a careful monitoring and your active participation, it is a very effective and well-established therapy. Remember the keys to success: starting the medication, safety in the hospital, taking every dose on time, avoiding interacting medications, and staying in close touch with your care team. We are here to support you every step of the way. Please never hesitate to ask us any questions you may have.